Hello, Paul Auerter with Medscape Infectious Diseases, speaking from the Johns Hopkins University School of Medicine. There have been two recent papers that have brought Epstein-Barr virus, otherwise known as EBV, into an interesting mix of whether it may be a cause of autoimmune type illnesses or prolonged fatigue after COVID-19. As a longtime student of infectious mononucleosis, which for decades was unexplained, it's interesting looking back at history that the link to EBV was actually after an accidental lab-based infection where a lab worker became infected and subsequently developed an infectious mononucleosis type illness, and therefore that link was solidly established in 1967. Through the 1970s and 80s, EBV was often thought of as a cause of fatigue and other subjective symptoms, so-called chronic EBV. And to this day, in my infectious diseases practice, it's not uncommon that serological profiles of EBV are checked. Patients are referred with a request of whether their EBV is a cause of their symptoms of pain or fatigue or poor sleep or brain fog, and if there's any interventions worth of note. Over the years, there hadn't been much credible evidence to link other than just the general serologic evidence that most adults, historically it's always been thought 95% of people by the time they're 40 are infected with EBV. However, the two papers that I think are interesting follow on the heels of lots of epidemiologic evidence over the years that have tried to link EBV as an association and perhaps a cause of things such as Hodgkin's lymphoma from a large Danish epidemiological study, and then also autoimmune diseases such as rheumatoid arthritis, Sjogren's, or lupus from a variety of studies that have suggested that incidence of these diseases are more frequent after someone has recovered from infectious mononucleosis. A recent paper in Science about MS in the US military found that there was a 32-fold increased risk of MS amongst 955 members of the military who unfortunately developed MS. Almost all who developed MS had evidence in their smaller cohort where they had samples longitudinally to assess for EBV that developed MS only after EBV infection, and this was on average 10 years after acquiring the virus. The other paper deals with so-called PASC, or post-acute sequelae of COVID-19, so-called long-haul 19, in 309 patients. That was published recently in Cell in January of 2022. And they identified 4 risk factors for this condition, including type 2 diabetes, the extent of SARS-CoV-2 viremia, specific antibodies, but they also noted EBV viremia as well. As I sort of sit back and wonder whether EBV is a linchpin in all of this, we still have no clear understanding of mechanisms, and we merely have descriptions and perhaps increasing evidence that there may be some role. Unfortunately, there are no antiviral agents that clearly control EBV, and in fact, unclear whether a control of EBV reactivation would play any role in prevention. That I think this becomes fundamentally a more difficult question, but one has always wondered if herpes reactivation contributes to disease states or symptoms such as fatigue. I'm always reminded of the studies of CMV in acute illness, especially in the ICU, and there anti-CMV therapy really did not appear to have any impact on the extent of critical illness, so the CMV reactivation was merely reflection of the disease rather than seem to be contributing to the severity of illness. I think probably, unless if there's some fundamental discoveries in mechanisms, we're really waiting to see whether something like an effective EBV vaccine might therefore prevent autoimmune illness or MS. There have been some candidate vaccines. They've unfortunately languished a bit. I think there's maybe an increasing role to look at EBV, which is something that may be a significant challenge. There have been attempts at HSV vaccines and so on, but this probably is going to be one of the few ways to truly get at whether abolishing EBV vaccine plays some role in staunching the emergence of autoimmune diseases such as lupus, possibly cancers, and even conditions such as long haul COVID or potentially MS. Thanks very much for listening.